Hi, I'm Dr. Nick Venturino. Let me take a few minutes to go over how you can check your child's spine to see if it's growing crooked or straight. Now, the medical term for a spine that's growing crooked is called scoliosis. About 1 in 10 children are affected by scoliosis in some degree or another. The reason that it's important to check your child for scoliosis is if it's left untreated, a crooked spine can oftentimes affect the heart and the lungs. Now, you can check your child's spine anytime before the bones stop growing. Typically that's between the ages of 21 and 25. But it's most important to have them checked for scoliosis before they have a growth spurt. Now for girls that's between the ages of about 8 and 11, and for boys it's between the ages of 10 and 13. Now the reason that's important is if there is a small curve and they hit that growth spurt, that curve can get very bad very quickly. So let me have Allie stand up and show you how to check your child's spine to see if it's growing crooked or not. Allie, if you stand here, we're going to put you right like that. Now we're going to start at the very top. And the first thing I want you to pay attention to, have your child facing away from you, and I want you to stand directly behind the child. Not where I'm standing, but directly behind the child. And we're going to take a look right at the top, start at the top and look at the base of her earlobes. So right in here, and we should see that they are level. If they're level, we know that's a good sign. If we see that one of the earlobes is higher than the other, then that's potentially a problem in the spine that needs to be addressed. Now the second thing that we want to look at as it pertains to the head is when your child is looking straight away from you, we should not see either side of their cheek more than the other. If we happen to see one side more than the other side, then we know there's potentially a curvature in there that should not be there. Now we'll move right down and we'll look right at the top of the shoulders. And again, you just place your hands on top of their shoulders gently and see if it's level. If we find that the shoulder is unlevel, and you may have recognized in your child when they put a shirt on that it just doesn't seem like it hangs right. Well, that may be due to one shoulder being lower than the other, and that being a potential curve in the spine. Now the second thing that we want to look at here in the mid-back is you'll find right at the base of their shoulder blade on each side, you want to put your fingers and just see if that lines up, again, level. If it is, very good. If we see that it's unlevel, again, a high potential for a curvature in the spine. And the third thing that we want to look at here in the mid-back is, does one side, one shoulder blade stick out farther than the other? That's obviously abnormal, and again, that may indicate that there's something going on as far as a curve in the spine. Now, we're going to move right down the back into the low back here, and typically you would just, again, get down to the height of their low back, and you put your hands right on top of their hip bones, and then just feel to see if it's level. You know, use your hands, place them there, and then look to see if it's level. If it's not level, if one side is higher than another, then we know that there's a curvature that's causing that. And again, just like with the shirt hanging unlevel, you might notice that one of the pants legs are a little longer on your kid all the time. Well, obviously that's a good indicator that something is off a little bit in the back. Now the next thing that we want to do is we want to bend them forward just about 40 to 45 degrees, and then you're just going to rub your finger gently up their spine and feel for any curvatures. Now while you've got them bent over here, you want to see if the muscles on one side or another are sticking up higher than the other side. So for example, if this left side was raised higher than the other side, then that's a good indication that there's a curvature in there, and that's where it can affect the heart and the lungs. You've got this rib cage that's potentially being closed off and causing a problem with the heart or the lungs. Okay. Now, some potential conditions that you might find associated with neck problem would be headaches, neck pain obviously, sinus trouble, or allergies. When we get into the middle back, then we start to see problems obviously like mid-back pain, but then we can also see an issue like asthma related to their allergies, or even some stomach problems, acid reflux, constipation, diarrhea type problems from the middle back. When we get into the lower back, obviously we can expect to see low back pain, maybe some pain into the legs, In young females, we can actually expect to see some potential problems with their menstrual cycle. So those are very good things to keep your eye out for if you find any abnormalities in the spine. Go ahead and sit for me. Okay. If there's any indication in your child that there's an abnormality or a mild curvature or any problems like that in the spine, bring them into the office and I will personally check them out free of charge, and we will check to see if what you spotted was a crooked spine was actually a crooked spine or not. Now, the curve of the spine can also be measured by x-ray, and if we did happen to find a problem in that spine, we'd get an x-ray, measure to see how much that curvature is, and then we could check that in about 6 months with a new x-ray to see if it's gotten better or if it's continued to grow crooked. Now, I hope this short instructional video helps you out. If you have any questions, don't hesitate to call me or my staff, and we'll be happy to answer any questions that you have. Again, I'm Dr. Nick Venturino. My office is located on the corner of Bears and Bruce B. Downs, and feel free to call me at 813-977-2383. Thank you.